Human beings are exposed to millions of bacteria on a daily basis, and one of them is Helicobacter pylori. Now, here to shed light on this specific bacterium is General Practitioner Dr. Makemba. Dr. Makemba, good morning and welcome.
Good morning, thank you for having me.
Doctor, what is Helicobacter pylori?
All right, Helicobacter pylori is basically a bacteria. For the purpose of our viewers at home who might not be in the medical fraternity.
And myself. I'm not in the medical fraternity.
I'll try to be as lame as I can.
Okay.
Basically, bacteria by nature are microscopic organisms.
Mm-hmm.
So if you're in a laboratory setting and you look at the bacteria under a microscopy, that's what you see. You can't really see them with naked eyes. So Helicobacter pylori is what we call a gram-negative bacteria that is spiral in structure.
Mm-hmm.
So in the laboratory, sometimes we do what we call gram staining. So if it turns out pink, normally we call it a gram-negative bacteria. So Helicobacter falls in that category.
All right. How does one get this type of bacteria?
All right. With the Helicobacter pylori infection, the exact mode of infections, literature seems to suggest that it's not as clear. It particularly happens most of the time in the pediatric population, which is children. We find most of the time when a child is growing up, they are still young, as they are being toilet trained. They probably don't clean up very well, and they tend to play with their hands, putting their fingers in their mouth. Then we have what we call FE, or oral transmission, or sometimes, oral to oral. That's basically where it happens most of the time, and especially in our setting in the developing sectors or developing countries, Helicobacter pylori seems to be very prevalent. The literature suggests the percentage is somewhat between 80 and 90% of the developing sector will find more of the infection taking place.
But you get adults that don't wash their hands either when they've gone to the loo afterwards.
Yeah, definitely. That also it's something in its own. It can also happen in the adult population in that country.
All right. How does it affect the body?
Well, basically, what happens that if somebody is now infected with Helicobacter pylori, okay, it's basically affect your gastrointestinal tract.
Okay.
Basically, which is your system where your food is absorbed. The gastrointestinal tract basically is a pipe. Look at it as a pipe, starting from the mouth all the way to the rectum and the anal cavity. So that is your GI tract, and that's where the infection can take place, particularly in the stomach and the area of the first part of your small intestines, called the duodenum. Yes.
And what is the effects there are for once you've contracted this
bacteria? Once you've contracted the bacteria, what could then happen is that it causes inflammation. The inflammation occurs particularly in your stomach and the first part of your small intestines, called the duodenum. That could result in gastritis, basically, which is inflammation of the part that I've mentioned. In chronic cases, one can also go as far as developing a duodenal ulcer. Ulceration can take place, and sometimes they can also perforate. And then when they perforate, they become very, deadly. Yeah, basically that's what happens with the infection of Helicobacter pylori.
Are those all the telltale signs and symptoms if you sort of think that you might have contracted this?
Most of the time, you probably wouldn't know that you have Helicobacter pylori infection until you develop a gastritis. Now, gastritis, by definition, as you have said, is basically inflammation that then will produce signs like you feeling a bit of an epigastric pain. It's often associated with nausea. Vomiting can happen, but it's not as frequent. And of course, there are certain other aspects that can trigger gastritis, then leading to finding out that you got Helicobacter pylori infection. Perhaps individuals that consume a lot of alcohol are more prone to getting inflammation. And then if they go for further investigation, they can end up finding that they got Helicobacter pylori infection. Literature also seems to suggest that there are some other aspects, like if you perhaps eat a lot of spicy food, fizzy drinks also can, to an extent, predispose you to getting gastritis, and then later on finding out that you got Helicobacter pylori infection, and somewhat a bit of, consumption of fatty meals and stuff like that.
All right.
But the list is very long, so that's just but a few.
What kind of treatment is available once you've contracted this?
Right. I'll probably try to explain the treatment aspect as in three categories.
Okay.
We probably have what we call a non-invasive treatment, and then maybe an invasive treatment depending on the severity, and then the aspect of lifestyle modification. If somebody comes into our rooms, for instance, at our level as general practitioner with the symptoms that we have discussed earlier, the thing to do perhaps is to send them to the laboratory, and then we take some of the stool specimens for testing. We do what we call H. pylori antigen stool test. And if the result then come out positive, then the next thing will be to treat the patient. If the case is not so severe, what you then do what we call a non-invasive treatment, where we put them on some medication. Basically, we've got two broad categories. We've got what we call a proton pump inhibitor and antibiotic. For our viewers at home, a proton pump inhibitor is basically a class of medication that will help reduce the stomach from secreting a lot of acids. Things like omeprazole, and then you put them also on antibiotic. Basically, why? Because they are dealing with the bacteria. So things like clarithromycin, metronidazole, or amoxicillin. And then the other category would then be if somebody perhaps come into your rooms and you suspect that they got gastritis and in the background of Helicobacter pylori infection, you treat them and they're not getting better, or the symptoms seem to be severe. What you then can do is, at our level as general practitioner, probably would refer the patient to a specialist, be it a surgeon or a gastroenterologist. And then what the specialist will then do is they will do what we call a gastroscopy. A gastroscopy basically entails the patient is taken into either a theater environment or a hospital environment where they have a scope that they go into the stomach, through the mouth into the stomach and the small part of the intestines. So basically the gastroscopy is just a tube that has a little bit of a camera, the tip connected to a screen. So as the specialist is pushing the tube down the throat, they are basically looking at the lining of the stomach. They are trying to look for areas where there is any evidence of inflammation, where it appears red, or if there is some ulceration that I've talked about earlier. And then what can also be done in the same breath is that the specialist can take what we call a biopsy. If they see an area that looks suspicious, they can puncture it a little bit, take a piece of that, send it off to the laboratory for further testing. And lastly, of course, lifestyle modification is quite important in the aspect of also managing Helicobacter pylori. We, of course, give dietary advice to our clients in our offices, but also involving the dietitian in basically managing this condition. So you send your client to a dietitian and they are able to be informed on what kind of food item to consume and what not to consume and what to use in moderation. In that way, we get a better result.
Fantastic. Just quickly and in closing, other than the dietary aspect where you're supposed to look after your health and what you eat and so forth, any other preventative measures besides washing your hands, obviously, when you've gone to the loo?
All right. In our developing setting, basically, like you say, I mean, washing of hands is probably by far the most common. I would not necessarily say there's any other preventative measure in the sense that if you get exposed to the Helicobacter pylori, for instance, you probably might live with it for the rest of your life and not even know you got it, all right, unless you develop all these other symptoms. So good hygiene, basically, and just taking an inventory into your own personal health, going to your general practitioner, asking all the kind of, the right questions, and then also, just being upfront in asking for some tests to be done. Right. And then, basically get to know where you stand.
What's the worst case scenario should a patient have Helicobacter pylori and they're not responding to the medication? What are the consequences thereof?
Okay, well, if you put somebody on medication, then that's what we call a non-invasive approach, okay? Yeah. And you realize that the person is not getting better. Of course, then the next step would be to refer them to a specialist, be it a surgeon or a gastroenterologist, have them to have a gastroscopy that I've just mentioned earlier. So with the gastroscopy also, the specialist is able to pick up other issues. As they go down the tube, they are looking at the stomach. They're able to see, are there other, problems that might be, of course, in the background of the infection that one cannot or would not have picked it up earlier if perhaps not having done the gastroscopy. Yeah.
Doctor, thank you so much for being here this morning. That was very interesting.
Thank you very much. Thank you.
All right.
I'm glad that you...
That was Dr. Makemba speaking to us this morning about Helicobacter pylori, a specific bacterium. Very interesting and educating. We'll be back shortly after this. Stay tuned.